For this particular initiative, I'm delighted to be able to talk to you folks about this. In 2000 was the first time I ever spoke with the State Workforce Board, and it was about a different disability initiative that we were initiating throughout the state in regard to including people with disabilities in the workforce center system. And a number of things have happened since then with other agencies in terms of focus groups of people with disabilities, with our staff where it's in regarding to sharing customers, with regard to working with businesses and supporting them in being successful. And as a result of those focus groups, we've done a number of things in partnership with multiple agencies. At a certain point in this presentation, Dave Mitchell's going to talk a little bit too about the partnerships that we have with the state agencies in addressing employment for people with disabilities. The timing of this particular initiative is particularly good. A number of things, the Director's Initiative with the Skilled Iowa Project, working with businesses including people with the opportunity to have work experiences and develop skills in addressing the middle skills gap. The many more access points we have throughout the state where we didn't have access to employment services before is another strategy that is going to help all Iowans, and our focus is going to be seeing how we can do a better job of making sure that people with disabilities who maybe haven't been included in employment services before are accessing those services and taking advantage of them. The Department of Labor's intent with the Disability Employment Initiative as they release the application to states around the country was to enhance the capability of the workforce center system to include people with disabilities in the workforce in the communities in which they live. When we first were addressing employment services in partnership, we recognized that we are very dependent upon the expertise of our partner agencies to support us in being stronger. Advocacy organizations had told the leadership of the one-stops is that in order to improve the opportunity for people with disabilities to be more included in employment, those service systems that are required to serve everybody need to do a better job of including people with disabilities too. And that's where we've expanded our friendship, our alliance with the initiatives and expertise of our other partner agencies. It's the intent that the one-stop system is fully accessible to people with disabilities and that services are responsive to them. With the Workforce Investment Act, of course, as we talked about it way back around 2000 also, it was that vision that in the service system we addressed the disconnects and fully included people with disabilities in the work and facilitate the capacity of our partner expertise to become resources to each other in serving common customers. We've had, over the course since 2000, several collaborative planning and demonstration grant initiatives. One of our focuses with this effort is to make sure with some of our previous initiatives, we're pretty close to being able to be sustainable with everything that we were doing and with everything that we've learned. We didn't quite make it. Our plan is, with this one, we're fairly confident if the Ticket to Work program from the Social Security Administration is successful like we hope it is, if there aren't changes in that, that local boards will have funding to be able to continue these initiatives without grant funding, without additional funding sources for that. We've had the Navigator Initiative where we put the disability subject matter expert in each of our one-stops as connectors, problem solvers and networkers for businesses and for job seekers with disabilities. We've had a very important Social Security benefits planning initiative for people that are on Social Security disability benefits. There's a lot of perceived disincentives for them to go to work. And unfortunately, we have a lot of Iowans who make the conscientious decision to stay on their benefits and not risk losing them. And when they make that decision, they make a decision to live the rest of their life at a poverty level of income. And that's something that we're not ready to accept as an option we want to encourage for folks. So we're working at developing the expertise across our agencies to be able to support people in using Social Security work incentives successfully and building their own confidence that they can be successful with their careers and not be dependent on their benefits.
Is there an amount that they can earn and still claim the benefits? Is something?
It varies by individual. Folks call us and they say, how much can I earn? And usually you have to get a lot of information from them, what type of Social Security disability program they're on, so they have varying thresholds where they'll lose their benefits. And there's two different specific Social Security benefit programs that we're talking about. One is SSI, which is about 20%. The other one is Social Security Disability Insurance, which is about 80% of the folks that we're talking to. And the SSDI is like a benefit that they paid into while they were working, and then they have an injury or a disability that occurs after they've been working, and then they get that benefit after they come off. So it varies about what type of program.
The simple answer would be yes.
Where I was.
Yeah, sorry.
Okay. It just varies, that's all.
Yeah.
However, if they go off the benefits, they cannot choose to come back on?
They can.
Okay.
They can. They can, and they've worked on that too, because that was a disincentive also. There was the fear. Folks have to work pretty hard to get on their benefits, and they don't want to have to repeat that. We've also got, within the past 10 years, we've created another safety net. A lot of people, they can give up their financial benefits if they're working, but they have the medical benefits are even more important to them. They may have a significant type of disability which requires a lot of medication, and if they lose their medical benefits, then they can't afford to work. And in Iowa, we've created a Medicaid buy-in program for people with disabilities. And if they can't get on the company's insurance because of pre-existing conditions or something like that, they can apply for Medicaid for employed people with disabilities. It's a very good insurance program. As they increase their earnings, they pay a premium into it, but the Iowa legislature created that as a safety net for these folks.
Medicaid for employed
people with disabilities. As long as that's in place, folks can be a little bit more comfortable about giving up their benefits with the Social Security benefit plan. And as they increase income, they increase their responsibility for what they pay into that plan also. So sorry for the long answer. Usually when people ask me that, they're saying, how much can I earn? And I say, well, we have to sit down and talk about that first. The integration model, for our one-stops, we've had a lot of disability initiatives, and they did a real nice job of supporting our staff and feeling comfortable that they can include people with disabilities in their service system. One of the things that the integration model did for us is the folks at the front that are greeting everybody coming in the door see everybody as their customer when they come in. They still make referrals to other agencies that can support them, but they don't do that as an option instead of serving them themselves. So that is a very positive change. The Ticket to Work program, as I mentioned before, Social Security, they see the liability themselves in increasing what they have to pay out in benefits and knowing that that's going to run out someday. The figure that they used to say 10 years ago is less than half of 1% of everybody on Social Security disability ever comes off. And they wanted to do something to change that, to increase the numbers of people who were working satisfactorily and coming off of benefits. And So since they don't provide employment services, what they wanted to do was invest in those employment services that exist. And they said, well, if you work with people that are Social Security beneficiaries, do the Ticket to Work program, and you sign their ticket, if they become less dependent, we'll pay some of what we would have paid them in benefits to you. And everybody's going to be a lot better off. And so we're involved with this program. It's a way that we see all of the agencies we work with being able to strengthen what they invest in their infrastructure to be more successful in including people with disabilities with this partnership with Social Security. The strategies we have in the Disability Employment Initiative, as Dave will talk a little bit later, we developed this proposal with multiple agencies and put it together. Iowa Workforce Development is serving in an administrative capacity in implementing this program on behalf of our partnership. At the local level, the strategy is going to be building partnerships with our local boards that perhaps could be strengthened. Perhaps there's some partnerships that could be expanded in the areas of mental health or other areas that could support them in being stronger and responding to that population. An idea called integrated resource teams. Sometimes the concern for people's program performance makes them nervous about including people with disabilities because of the perception that they're not as likely to be successful. And what we're asking for with each of our pilot regions is for folks to take the leap of faith and co-enroll folks together in multiple programs and problem solve with them together as they're working with them. And back in the 80s when I was working in supported employment, we call that person-centered planning, where you sit down with multiple people with diverse expertise with an individual and look at maybe sometimes some out-of-the-box strategies to do that. Innovative practices, that's a good segue. For some folks with significant disabilities, we're looking at things that maybe we haven't traditionally done as much. The self-employment options for some individuals, maybe expanding the use of on-the-job training. Of course, this fits in incredibly well with the Skilled Iowa Initiative also. So, and the increase of financial literacy. Using those work incentives, tax incentives for these individuals. One of the things that our benefit system has done is required people to burn all of their assets, which makes it very difficult for them to respond to day-to-day challenges that they have. The example that I use quite often is somebody was telling me a person lost their job because the refrigerator broke down. And it was more important for them at that particular time to find something to do with their meat so it wouldn't spoil and the milk and the eggs. Being a single parent, didn't have a lot of resources, and so they missed that day of work and lost their job. For folks who have more assets and more resources, they have the capacity to respond to those types of challenges and not miss work and be able to keep their job. So we're looking at ways to support people in increasing their own assets and understanding of financial literacy as well. Greater access to services through technology in our integrated offices and the services that currently exist to support all job seekers but maybe aren't accessed as much by individuals with disabilities. And then, as I mentioned, the greater inclusion in the mainstream services, using the National Career Readiness Certificate and the Skilled Iowa Initiative, taking full advantage of that. Going back. The last thing, we're going to work with each of the pilot regions to have a disability subject matter expert that kind of facilitates this with the local leadership using these practices. kind of managing the Ticket to Work program for the board, managing the decisions that the local leadership team makes for this particular initiative. The key players, again, the state partner agencies, the regional workforce investment boards, the local leadership is really paramount in making the connections with other resources throughout the communities that can support their one-stop and being successful. The local leadership teams, as an adjunct to the regional board, the leadership of the employment service programs. We hope a couple of the board members that are interested in the success of this program and in making the connections and making it successful. The disability subject matter expert that I referred to, we have a model for this that was developed with the Navigator Initiative and Iowans with Disabilities. We will continue to talk to Iowans with Disabilities. A lot of the strategies that were developed here for this were based on feedback we've gotten from focus groups of Iowans with Disabilities. We will talk to more Iowans with disabilities, different types of disabilities. One of the things that we've learned is that we do serve many people with disabilities in our service system. And we're very successful with many people with disabilities, but there are still certain populations of people with specific types of disabilities who don't think of our partnership as a resource to them, and we want to find out what we can do together to be more responsive to them. The implementation steps, we're going to select 5 study regions out of 11 regions that have expressed interest. We're going to meet with those boards and develop local leadership teams. We'll do the focus groups with the job seekers with disabilities. And we're going to coordinate with similar disability initiatives. And then as we move forward together, we'll continue to make reports to you folks. Any changes or suggestions that you folks see being important to make this project successful or seeing it be stronger in the state of Iowa, we'd really like to get your guidance on that. And as we need to make adjustments, we'll do that together. Study regions have been selected. The handout I gave identifies 5 particular regions that I was real surprised. I thought the Department of Labor would take a little longer and keep us on edge in waiting. 11 regions had expressed an interest in operating as pilot regions, and they were going to select 5. And those 5 are shaded on the map. And we've already started talking with the workforce boards and getting started. We haven't established agreements yet. But in those agreements, we're talking about we'll pass through funds to the regions. They'll identify a local agency that will employ a disability subject matter expert. In the grant, they refer to this as a disability resource coordinator. Study regions will receive technical assistance in their operation. We've got, through the Department of Labor, the commitment for some national trainers and technical assistance providers that will help us with this. Within their state agency, we've got some excellent state agencies. We have an 8-state agency partnership, but others that we're working with and have expanded that partnership through the Employment First Project. Excellent, diverse expertise that we're asking these folks to make their expertise available to these 5 boards to answer questions as they go and provide training to staff. And we'll discuss the needs for that with them as we go. Exploring again new community partnerships. And there's some flexible funding to support their use of innovative practices. They'll receive a little bit through the grant, but all of these regions we're talking about are already generating Social Security Ticket to Work incentives that they can use as flexible funding to purchase services as well. The expected outcomes, we'll be talking with the national evaluator, but we're looking at our own performance data. data on the effective use of employment practices, our increased partnership, and sustainable changes that we're able to see occur without needing to depend on grants and other funding in the future. We have a state leadership team, and they've committed to providing assistance to these local teams. And then we'll have a local leadership team that we'll work with. Some things on added focus. I mentioned the increased access to our services through technology. We will be looking at and meeting with both people with disabilities and people who are building that system to see if there's more ways in which we can make that a stronger system for people with disabilities. Transportation is and has always been a big issue for a lot of people with disabilities, a lot of people in poverty in general, and we'll be working with the Department of Transportation and other folks to see how we can, if there's things we can do to improve that. Increasing access for deaf Iowans and increased business partnerships. Through our state agency partnership, we've got a very strong emphasis through what we've created as an employer's disability resource network that we hope can continue to be a stronger resource to the businesses. So, Dave, do you have a few minutes? Do you want to talk a little bit about the other concurrent initiatives we have?
Sure. I think the vocational rehabilitation staff's really excited about the DEI initiative. We've been active partners in the one-stop shops, and I think this effort will really be an emphasis on how services are coordinated and streamlined. So when the consumer walks in the door, let's make sure we get them to the right place, and there's a sense of urgency about that. So I think it'll help us coordinate services with that consumer to get them to the right place and minimize duplication. One of the things that's unique about Iowa that we're hearing from the federal basis is Iowa's efforts at collaborating and partnering to improve service delivery. And Iowa has what we call a governance group and an operations team. It's made up of our 8 state directors or representatives from those directors. So the state agencies that are represented on that are the Workforce Development Center, Department for the Blind, Department of Education, Department of Human Services, Department of Human Rights, Voc Rehab, the DD Council, and the Department of Aging. And through that group, the operations team meets on a monthly basis, and they're talking about what are the service delivery issues that are occurring across the state, which of the state departments are doing what to improve that service delivery, where are the gaps, where are we seeing some duplication, and what can we do to minimize that duplication. And through that effort, we've been able to leverage some funding that helped with getting the DEI, that helped with the Iowa Coalition of Integrated Employment, which is the DD Council and the Department of Ed, to get some funding for some transition projects occurring within our secondary schools, and the Employment First, which is a Department of Labor ODEP grant, and we've been able to double the number of projects that we're serving in those areas because of the coordination occurring between the state departments and how those funds are getting leveraged. Back to the DEI, I think one of the things that is built into this model is also an effort at sustainability. And Doug's mentioned the ticket to work and the Social Security. Hopefully we're going to find some promising practices that helps us sustain these models as we transition in. So I think there really is a sense of excitement about the projects, and that we're optimistic that we're going to see some outcomes as more people come through the doors and we get them to the right service.
Thank you. You know, these initiatives by themselves can only go so far, but if we're able to couple it with the other efforts going on at the same time, it makes them all stronger, and certainly the steps that we're making individually between the agencies, putting that effort together and combining it, will result in more people with disabilities working, and we expect to be able to. Again, this is the on the other side of the handout is the what we had in the grant proposal is the structure for leadership. And when we talk about partnership, we see each other as everybody that's participating are leaders. It's emergent leadership. Wherever the question is, we have somebody with that expertise in our partnership to respond to those questions. The places where the stars are, Dave, do you want to mention what those are?
Sure. The stars are where we have the projects for our Employment First initiative, and those are 6 pilot projects spread out across the state where we're looking at serving consumers with the most significant disabilities that are typically served by workshops and day programs. So these are individuals that may not be getting into the one-stop shops. They may not be considered for competitive integrated employment. And we're looking at a different model to say employment as a first choice should include community-based options. And those projects are going to help us look at that and identify some strategies where we think we can be successful in helping people get jobs out in the community as a first choice.
And we look at some combined reporting and resource sharing through both of these initiatives too. Yes, Al?
Northeast Iowa is missing from this, and I don't, as the Iowa chair, I don't remember us talking about this. Did we, and did I?
The board was interested in being one of the 5 pilot projects.
Okay.
We had 11 of the 15 regions did express an interest, and that was my frustration with the project because, one of our thoughts was, why do we want to use a research model to learn all over again what we've learned already in the last 12 years? But that was the focus of this application, so we were required to have a selection. The 5 regions were randomly selected. We would have liked to have been able to do these pilots in all 11. They used a computer, and it really surprised me. They called us on Tuesday. They selected the regions on Thursday.
Okay, I missed the first part of this, I'm sorry.
But thank you for
I have
asking.
a daughter with a disability. She has brain cancer, and she lives in Los Angeles, so it's a little different. But still, I have a real interest in her. And she's, she's educated and everything, but she does not get out of the house or doesn't do any employment. And she's very smart, so I have a real interest in that kind of thing.
Well, and I hope you'll take back to Region 1, and the folks there working in the one-stops are aware of this also.
Yes.
We still support them with what they're doing with their partner activities and responding to job seekers with disabilities. All of our agencies have offices in those areas, and Region 1 is actively working with the Ticket to Work program to build their local resources there.
Thank you.
Was there supposed to be 6 regions to begin with, and we went down to 5?
Oh, the 6 are the stars. There are 6 pilot projects through the Employment First and Iowa Coalition projects. The 2 down in southwest Iowa are combined. That's a shared one with Keast Incorporated and Nishna Productions. And then the shaded regions, Spencer 3-4, Sioux City 12, Waterloo 7, Des Moines 11, and Burlington 16 are the 5 DEI regions that were selected.
So there's 2 spots in Region 11.
Yep.
Okay.
Yep, thank you. Thank you for your questions. Are there any other questions for Dave or I?
You pick the regions again, Dick, Doug?
Department of Labor. And all 11 were very, very, very much wanted to participate. In fact, I was getting success stories and letters of reference from one of them. And anyway, thank you very much.
I might just add, Doug, on the yellow stars for the Employment First, those project sites were selected through the Iowa Association of Community Rehabilitation Providers and the Iowa Coalition of Integrated Employment. And that's how those funds were kind of leveraged to maximize it and actually double the number of yellow stars that were not initially expected.
Now, on the topic of helping to facilitate people with disabilities to employment, it's a completely different project that I'm going to share with you. The governor is working in conjunction with Tom Harkin, Senator Harkin, on perhaps getting an event here in Iowa from the NGA, because the incoming president or chair of the NGA has special interest in people with disabilities. And of course, Senator Harkin is the grandfather of all of our ADA kinds of requirements and that whole philosophy. And he obviously has some personal experience as well within his family. And so about a month ago, I was asked to come to a meeting where Senator Harkin and a couple of his folks and the governor and I met about what can we do to focus on helping be the glue that gets this community into the job and employment scenario better than what we have. Because, we really don't have good data for a number of reasons. One is a lot of the data needs to be self-reported by the people and who are in that kind of a challenge situation. And we have ways of collecting more data so we can track people to work, people to employment. And so Paula is working on some ways that we can track that. But the idea is that since we have a chair of the National Governors Association who has this as a particular interest, and since then the governor is one of the leading folks on the educational committee of the NGA, we were looking at there's two more events that the chair of the NGA wants to have throughout the country, and we've never had anything like this in Iowa. So we were trying to organize perhaps in the April, May, June timeframe before this person rotates off of being chair of the NGA to have some kind of a national event here with the disabled community and employment and I wouldn't call it a summit, but it's something like that so the conversation can be elevated and we can get some more attention on helping and moving the disabled community into work. And of course, Senator Harkin is looking at some metrics that he would like the governor to commit to, and I don't believe there's any commitment on metrics yet. But obviously, his push to the governor is if you're going to really create 200,000 more jobs, is there a percentage that you can commit to that you will make sure that the disabled community has an opportunity for? Senator Harkin is also it's a great relationship with Walgreens throughout the country, and they have some models of employment processes for the disabled community. And I mentioned that the one in Iowa that stands out to me, the one business that I think has a great program in this regard is Hy-Vee. And Hy-Vee employs 62,000 people in the state of Iowa. And so maybe we can marry some of these best processes and practices in HR on this particular topic to help have a better kind of match to employment. So we're working on that as well. You might see something like that come out. But we are trying to organize a date. If we get to a date, I'll send you all a note so that you'll be aware of when that is. I don't believe it will be during session, but that's just another activity that we're working real hard to bring some attention to the opportunity of employment for people.
Are disabled veterans part of this?
Yes.
Okay.
And they'll be part of our state leadership team with the Disability Employment Initiative also. Older workers will be part of it too. Thank you all very much. Really, again, appreciate the time. As I leave, I did talk make a lot of references to the Skilled Iowa Initiative. I'd like to give some props to our Deputy Director who's going to talk about in more detail the Skilled Iowa Initiative, and I think you'll recognize where the obvious benefits are going to be for access to these opportunities for the folks that we'll be working with here too. So thank you very much.